This is Sita. Sita Chetri has been trained by Children Project Nepal to build smokeless stoves and is an active member of the NGO committee in Aruchour, Nepal. This is Sita's family, or this was her family until March this year, when her husband Jabhat Bahadur Chetri died from TB. He was diagnosed with TB 5 years ago and could only afford limited treatment. They were unaware that without continuing medical care, he might die. This is Tej Kumari. She is 9 years old. 3 years ago, her mother and sister were drowned during the monsoon. She is now cared for by her 19-year-old brother and elderly father. Recently, her hair became so badly infested with head lice, the only remedy was to shave her head completely to allow the infections to heal. Head lice is an everyday problem for many children and adults in Aruchour. Families have no access to treatment shampoos, so it is not uncommon for the infestations to cause serious infection as well as prolonged discomfort. Aruchour is a remote mountain village in the foothills of the Annapurna mountain range, with about 4,000 inhabitants. Families grow food for themselves and their livestock on the steep hillsides that have been terraced for hundreds of years. There is no proper sanitation, running water, or mechanisation. There is little paid employment and only limited medical help available in the village. Treatment of any major illness or injury necessitates a 5-hour journey to Pokhara by bus. Children Project Nepal has been operating in Aruchour since 2002, providing preschool nurseries, library facilities and community resources. Until now, the organisation has only engaged in preventive health work, providing toilets for all 9 schools and clean drinking water at many schools. Prevention of respiratory disease, one of the biggest killers due to the custom of cooking on open fires within the home, has been tackled via the provision of smokeless stoves to all households in the village. The death of Jabhat has prompted the trustees of Children Project Nepal to draw up a more focused health plan for their work in the village. Whilst being aware of a need for more investment in this area, they had been reluctant to proceed without adequate funding. This was to ensure that any initiated intervention could be effective and ongoing. There is a health post in the village, staffed by a newly qualified dentist, a first aider and a villager with some midwifery training. Facilities are basic and require completely upgrading. Specific investment is needed in appropriate refrigerated storage for medication. More extensive provision of prescribed drugs needs to be explored. Organised and effective access to clean water requires considerable investment. A teacher from the village raised £600 over a period of 5 years to be able to build this water facility, which now makes clean drinking water available to a large lower caste community in the village, as well as providing a local washing facility. Children Project Nepal is aiming to have a ring-fenced health fund, firstly to upgrade the health post, secondly to fund essential water supply improvements needed across the village, thirdly to introduce better health education both in the schools and in the wider community. Once this programme is underway, Aruchour will become better placed to seek assistance from other organisations offering specialised health inputs, for instance glaucoma cataract screening, well woman clinics and the extension of existing vaccination programmes. This is a vibrant, hard-working community. Children Project Nepal works to improve the lives of children and families living in Aruchour. With your help, we could also improve their health chances and prevent further unnecessary suffering and tragic, avoidable deaths.